Question number 51. A 9-month-old child is diagnosed with Hirschsprung disease. He is scheduled for the surgical operation. So which of the following is the most common complication expected this age? Option A, mechanical obstruction. Option B, enterocolitis. Option C, pleural effusion. And option D, esophageal atresia. So option B, enterocolitis is correct answer, because Hirschsprung disease is a kind of your congenital birth defect where the nerve cells are missing from the part of the large intestine जो कि prevent करते हैं normal muscle contraction को, और further it will lead to the blockage of stool or even severe constipation. So due to the severe constipation, further it will lead to the inflammation, or inflammation will cause the enterocolitis. Question number 52. An 8-year-old child admitted to the pediatric ward diagnosed with beta thalassemia. So the nurse is planning to give the health education to the mother. So which of the following educational need is recommended for the mother? Option A, compliance to hydroxyurea. Option B, compliance to hemosiderosis. Option C, compliance to Disferal. And option D, compliance to iron supplement. So here the option C, compliance to Disferal, is correct answer, because beta thalassemia is an inherited blood disorder where the body makes the less hemoglobin and the oxygen carrying protein. So due to reduced or absent beta globin chain, further it will lead to the anemia, or in addition to that it causes the iron overload as well. So to minimize the iron overload in the body and to minimize the or prevent the organ from the overload of the iron, so this medicine acts as a chelating agent and that bind to the excess iron and prevent the various organs from the damage. Question number 53. An 11-year-old child has been diagnosed with diabetic insipidus. So which of the following is disorder? So option A, posterior pituitary. Option B, adrenal medulla. Option C, anterior pituitary. Or option D, adrenal cortex. So option A, posterior pituitary, is correct answer, because diabetic insipidus is a rare disorder where the body can't regulate or fluid balance, or even cause the excessive sweating or excessive thirst or even excessive urination, even a large volume of dilute urine. So it stems from the issues with the hormone vasopressin, so which releases from your posterior pituitary gland. So in case of posterior pituitary damage or posterior pituitary tumor, so further it will lead to. Question number 54. A nuclear plant experienced a leakage and all involved workers were brought to the emergency department for the treatment. So the medical team prescribed iodide for the worker to block the radioactive iodine to be absorbed by an organ. So which of the following organ is most sensitive to radioactive iodine? Option A, brain. Option B, lungs. Option C, kidney. And option D, thyroid. So option D, thyroid, is correct answer, because thyroid is the most sensitive to radioactive iodine, because it's only gland that actively absorb the iodine from the bloodstream to make hormones. Question number 55. A 63-year-old woman experienced a right hemispheric stroke, so which result in the swallowing difficulty. So which of the following impairment causes dysphagia? Option A, paralyzed vocal fold. Option B, oral muscle spasticity. Option C, decreased level of alertness. And option D, impaired oral movement or sensation. So in case of dysphagia, the patient can experience the impaired oral movement or sensation. So option D is correct answer. Question number 56. The nurse is assessing a 65-year-old patient who reports the onset of fatigue, weight loss, night sweats, and the productive cough, which with the thick sputum. So the nurse would immediately initiate the isolation precaution for which of the following? Option A, influenza. Option B, pertussis. Option C, bacterial pneumonia. And option D, pulmonary tuberculosis. So option D, pulmonary tuberculosis, is correct answer, because these all are the symptoms of pulmonary tuberculosis. Question number 57. A patient with conjunctivitis report the presence of photophobia and moderate purulent eye drainage. So which of the following instructions should be administered? Option A, darken the room. Option B, avoid touching the eye. Option C, rest in the prone position. And option D, use the sterile gauze to remove the drainage. So option A is a darken the room is a correct answer, which help the patient in case of photophobia. Question number 58. A patient who is receiving chemotherapy has a platelet count of 49,000 per mm cube. So which of the following nursing action is necessary? So option A, crush oral medication. Option B, minimize the invasive procedure. Option C, limit intake of vitamin K rich food. Option D, monitor the temperature every 4 hourly. So definitely at this level bleeding risk is increases, so we have to minimize the invasive procedure. So option B is correct answer. Question 59. While reviewing the stress management technique with a patient diagnosed with the multiple sclerosis, so which of the following is most likely nursing intervention? Option A, relaxing in the warm bubble bath. Option B, yoga in cool room. Option C, cross country running. And option D, sunbathing. So option B, yoga in cool room is a correct answer. Question number 60. A patient with diabetes mellitus and multiple sclerosis has been prescribed the baclofen. So which of the following is the most likely side effect? Option A, renal failure. Option B, optic neuritis. Option C, muscle tremor. And option D, increased insulin needs. So option C, muscle tremor is correct answer. Apart from these, other adverse effect of baclofens are drowsiness, dizziness, weakness, headache and increased urination.